Hey, welcome to The Explainer. If you're a caregiver, you already know that giving out medication is probably one of the most important things you do, and it's a task that needs absolute precision. I mean, there's just no room for error when someone's health is on the line. So today, we're going to break down the safety checklist that every single caregiver needs to have completely mastered.
So where do we even start? Well, it really all boils down to one single fundamental question. What are the absolute rock-solid rules you have to follow every single time you handle medication? Let's get into it. Okay, so the absolute foundation, the thing that holds this all together is what's known in the industry as the 5 rights of safety. The best way to think about this is like a pilot's pre-flight checklist. It's simple, it's really powerful, and it's designed to stop mistakes before they can even happen.
So what are they? Here they are, the famous 5 R's. First, right patient. Are you 100% sure this medication is for this person? Right medication. Is this the exact drug that was prescribed? Right dose. Is the amount you're about to give correct? Right route. Is this supposed to be a pill, an eye drop, an injection? How is it taken? And finally, right time. Is this a morning pill, a nighttime pill, with food? You have to check every single one of these every single time. This is the absolute bedrock of medication safety.
So you've got the 5 rights down pat, but what about the prescription itself? Let's be honest, sometimes it feels like you're trying to crack a secret code, right? It's full of all these medical abbreviations. So let's decode a few of the most common ones you're going to see. First one up is BID. You are going to see this one all the time. It simply means twice a day. This little 3-letter code sets the whole daily rhythm for that medicine, and it usually means 1 dose in the morning and 1 in the evening. Simple, but so critical. Next up is PO. This one tells you the route. It's short for per os, which is just Latin for by mouth. So whenever you see PO, you know it's a pill or a liquid that needs to be swallowed. And that right there is a direct link back to one of our 5 rights, making sure you've got the right route.
And then you've got PRN. This one means as needed. Now, this isn't for a medication on a fixed schedule. It's for things that pop up, like pain or maybe nausea. But this one comes with a little extra homework. Anytime you give a PRN medication, you absolutely have to document why you gave it. This one really relies on your professional judgment.
All right, here's a little cheat sheet with a few more must-knows. HS means at bedtime. QD is every day, but watch out for QOD. That's every other day, and it's an easy one to mix up. SL stands for sublingual, which means under the tongue. And if you ever see STAT, that means drop everything and do it right now, immediately. Go ahead and screenshot this one. It's super handy to have.
Okay, let's switch gears and walk through a super common and honestly pretty confusing scenario. Imagine a resident is acting a little off. Maybe they seem tired, dizzy, or they're complaining that their vision is blurry. Your first thought might be a blood sugar issue. But is it too high or is it too low? What's your first move?
Now here's where it gets really tricky. Things like vision changes, fatigue, even feeling hungry. These symptoms can happen with both high and low blood sugar. And this right here is exactly why you can never, ever just guess. Guessing is dangerous. You need actual data.
So what's the right way to handle this? Here's the playbook. Step 1, always, is to take their blood sugar with the glucometer. Remember the mantra? Test, don't guess. Now, if that number is low, you give them something like juice to bring it up. If the number is high, you don't do anything just yet. You just wait 30 minutes and you recheck it. And if, after all that, it's still not in a normal range, that's when you pick up the phone and call the physician.
But there is one huge exception to this rule, and you really need to listen to this. If that very first reading you take is extremely high or extremely low, we're talking way out of the normal range, you skip all the other steps. You don't wait, you don't give juice. Your first and only move is to call the physician right away. That's a full-blown medical alert.
All right, let's switch it up and do a quick, rapid-fire round of some critical safety do's and don'ts. These are going to be simple, true or false questions, but they cover some of the most common and most important safety issues in caregiving.
First question. You've just given an injection. You're holding a used needle. True or false? You should carefully put the cap back on it before you drop it into the sharps container. What do you think?
The answer is a huge, resounding false. You never ever try to recap a used needle. That is the #1 way accidental needle sticks happen, and that can be incredibly dangerous. The needle goes straight from the patient directly into the sharps container. No cap, end of story.
Okay, next one. Picture this. You pop open a pill bottle and,
the pills inside look different than they did last month. Maybe it's a different shape or a different color. True or false? It's probably just a different generic, so it's fine to give it anyway.
That is also false. Yes, generics can look different, but you never, ever assume that's what's going on. A change in appearance could mean it's the wrong medicine or that the batch has spoiled. The rule here is simple, folks. When in doubt, check it out. Always call the pharmacy and verify before you give anything.
All right, last one for this section. A resident tells you they don't want to take their prescribed medication. True or false? You have to document this refusal.
This is 100% true. People have the right to refuse medication. Your job, your responsibility, is to document that refusal clearly. You'll usually note it on the back of the MAR, the medication administration record, with the date, time, and which medication was refused. It's a critical step for both legal and safety reasons.
We've covered the big overarching rules, but you know what? Real excellence in caregiving, it's all in the details. It's the little things that can make a massive difference in whether a medication actually works the way it's supposed to and if it's given safely. And timing is the perfect example. Just look at these details. When you're giving eye drops, you have to wait a full 45 to 60 seconds between drops in the same eye. Why? To give that first drop a chance to actually be absorbed. Or what if you're using two different types of inhalers? You need to wait 5 full minutes between them. Look, these aren't just good ideas. They're absolutely necessary for the meds to even work right.
You know, at the end of the day, all of these rules, all these checks and details, they all come down to one core idea. This line, it's actually from a caregiver's competency exam, but it says everything. I take full responsibility. That is a deep, profound commitment to the safety and the well-being of another human being.
And that really brings us to our final thought for today. Whether you do this for a living or you're just helping out a family member, what does that word responsibility really mean to you in your day-to-day actions? Because it's that deep attention to detail that truly defines what great care is all about. Thanks so much for watching.